off as much as possible.
Megan, in your recent piece for Jacobin, you wrote, quote, "Our overwhelmed, understaffed, austerity-starved hospital system is already in bad shape. It's not ready for what's to come." Talk about how the approach to making hospitals more lean, so to speak, has led us to where we are today.
Yeah, so there's this term from the private manufacturing sector called lean production. The idea of lean production is to trim fat, eliminate excess, and sort of improve efficiency, right? These are all euphemisms. In reality, what it tends to lead to is cutting corners. And typically, when you cut corners, you create externalities, and the externalities fall onto the workers who are not getting paid anymore. Because one of the reasons why you would implement lean production in the private manufacturing sector is to improve profits, right? So you're not paying your workers more, you're actually paying them as little as you can get away with, and you're also cutting corners, and all of that's falling to them, right? This has also been applied for the last several decades to the hospitals in our country. So in reality, while they say that it's about eliminating excess and improving efficiency, what this has led to is understaffing, like what John is talking about in his hospital, and under-resourcing and deregulation. Often the deregulation kind of comes as a retroactive justification for the disasters that are already taking place in the hospitals. The state will simply lower the regulations to say, well, it's not feasible for us to live up to the standards we previously had, so now we're going to lower the standards and now we can meet those, right? And you can see an accelerated version of this actually happening during the coronavirus crisis. Another part of this sort of lean production is hospital closures and mergers and privatizations and consolidations all across the country. A very good illustration of this is that in New York City, 19 hospitals have been closed since the turn of the century. And now they're opening up an emergency tent hospital run by an evangelical charity in the middle of Central Park. So basically what you see is that this country is balancing budgets on the backs of working class people, and the chickens are coming home to roost in a pandemic.
John, the New England Journal of Medicine had a remarkably grave and sober recommendation that it issued to healthcare providers, and among them was the following, quote, "We believe that removing a patient from a ventilator or an ICU bed to provide it to others in need is also justifiable." Went on, "The decision to withdraw a scarce resource to save others is not an act of killing and does not require the patient's consent." Your response to the New England Journal of Medicine, where they're recognizing that, like in Italy and elsewhere in the world, doctors, nurses, healthcare workers have had to make decisions, ultimately deciding which patient is going to die and which patient is going to live, effectively forcing frontline workers to act as God in a way. And the New England Journal of Medicine saying that it is not an act of killing and does not require the patient's consent. When you hear that as a healthcare worker on the front lines right now, what goes through your head?
Well, I feel extremely uncomfortable. I don't like that idea, and I don't want to be in the position to have to do that. And I don't want any of my coworkers, whether it be doctor or respiratory therapist or nurse, to have to be a part of any kind of decision like that. The reality is that emergencies happen, and there are always going to be circumstances where we don't have enough resources, no matter how prepared we are. But it just makes me think of how predictable so much of this crisis is, and how man-made so much of it is as well, and how many of the deaths are a result of just that failure to provide basic needs for something that is completely predictable, right? It's predictable that we would have a pandemic. It's also predictable that we'd have a pandemic that's a respiratory disease that would require us to have lots of things like ventilators. It also seems possible to be manufacturing a lot of this missing protective equipment, or even requisitioning it from the giant stockpiles that are out there in the private sector. My coworkers and I have actually gone out and located some of those stockpiles and bought them ourselves. And our hospital administrators haven't been able to figure it out. Or maybe they just haven't even tried because they're not on the front lines. That, I think, is really horrifying, and I wish that journal wouldn't make such a quick leap to acting like this is just an act of God. It's not completely just an act of God.
John, am I correct that emergency room staff at Highland Hospital actually started a GoFundMe to raise money for the equipment that you believe you're going to need?
Yep, it's raised over $40,000. We started that GoFundMe to buy something called a PAPR, a powered air purifying respirator. It's a crucial piece of protection when we're intubating a patient, putting a breathing tube down their throat. That procedure requires a number of caregivers all to be right up next to the patient and right next to their mouth. And the procedure itself sprays aerosolized virus up into the air. That's kind of a standard protection for that procedure when there might be something infectious. And our hospital system basically failed to provide enough, and it became really obvious to us that we just would have to figure it out on our own. And so one of the doctor's family members started a GoFundMe, and a whole bunch of us pitched in to do research and then find that equipment. And we were able to find it. I mean, the hospital is basically saying, well, too bad, it just isn't out there. And we found some, and we bought it ourselves.
The CEO of your hospital, Delvecchio Finley, makes around $700,000 a year. And I'm wondering, has he said anything about what it looks like to be raking in $750,000 a year in salary and watching his healthcare workers have to do a GoFundMe campaign for basic medical necessities?
The closest thing he's done is after we had a press conference last Thursday on the 26th.
If we don't have masks, if we don't have gowns, if we don't have sanitizing wipes, you guys, I mean, I literally lost my mind. I came to work the other day, there was no sanitizer at all. How can you do what you're supposed to do if you don't have that? You can't.